In class, we talked about electronic health records. An electronic health record is an electronic version of a patient's medical history. It is maintained by the provider over time and contains data that is relevant to the patient's care. This gives the provider the ability to go back into the chart and see notes from past visits, allowing their work to flow faster. I saw how this was implemented at the UCI Family Health Center when I did my internship there. The electronic health record did make it easier on doctors, but filling it out was time consuming. I even saw when their system was down for less than an hour. They were able to bring it back up, but had a lot of issues during that hour. Relying too much on the system might be problematic, but I definitely saw the benefits of using this.
According to the first article, the author mentioned 6 different components of the EHR system. These components are administrative, laboratory, radiology, pharmacy, computerized physician order entry, and clinical documentation. It is important that an EHR system allows access to patient information from these systems so that authorized healthcare workers are able to provide comprehensive care for the patients. The EHR system allows these 6 components to work together. For example, the administrative system component is able to provide information about the patient's identity, like their name and a unique patient identifier, which helps other systems like laboratory or radiology to link their test results and images for that patient. The pharmacy system component shows the prescriptions filled out to the patient. The computerized physician order entry lets physicians arrange services from radiology or pharmacy for the patient. And then the clinical documentation component provides the notes, assessments, and reports accumulated while taking care of the patient. These systems work together, which means that a very well-designed EHR system that is able to integrate these components will improve communication between different health settings and also improve patient care.
EHR is rapidly propagating in healthcare due to its efficiency in recording data, but a major concern within the community is whether the integration of EHR will uphold the patient's privacy. In the Application of EHR in Healthcare article, Professor Jacob Appel presented a valid statement as he mentioned that within the 12 million individuals who will require access to the interoperable EHR system, there is bound to be breaches of privacy. A common consensus to avoid this event from happening is to keep all parties involved accountable and on top of the data processing procedure. Additionally, healthcare systems should implement a universal set of EHR guidelines that must be followed. There are common trends that arise as EHR develops. Starting with technical trends, web vendors and ontology languages are in the early commercialization phase, but once these factors have reached full progression, there will be an increased use in extensible markup language and resource description framework, which will in turn lead to more organized data that can be found on the internet to obtain more useful search results. In regards to business trends, there are typically 3 stages when implementing a technological innovation into business. The 3 stages are initiation, acquisition, and consolidation. EHR is currently in the acquisition phase with businesses like GE, Simons, and McKesson integrating EHR into their products.
From the second article of this week, we learned about systems called the computerized physician order entry systems. The CPOE systems will send alerts of potentially harmful drug orders or potentially fatal medication orders. Even though CPOE systems are working great in recent years, especially there are 96% of US hospitals meet Leapfrog's standards of CPOE implementation, these systems still miss dangerous and fatal medication errors. According to Leapfrog Castlight report, CPOE systems failed to send alerts of 39% of potentially harmful drug order and missed 13% of potentially fatal medication orders in 2015. The report also stated the CPOE systems should be improved as soon as possible to protect patients from get injury or even death. To solve this problem, Erica Mobley, an employee from Leapfrog Group, suggests that the hospital should communicate with their health IT vendors and clinical leaders and update their medication list on time.
Computerized provider order entry systems allow managing physicians to send treatment instructions in any form, i.e., lab and radiology instructions, medication orders, and so on. The idea of CPOEs is to reduce errors and improve efficiency, yet they seem to be fraught with issues at 39% of potentially harmful drug orders and 13% of potentially fatal orders were not alerted. Despite the presence of this system for several years, the past 5 years have not seen a decrease in the number of failed alerts until recently, and even then the decrease was slight. The system is incredibly beneficial, however, and ultimately makes both physicians and the patients' lives easier. However, a safeguard system needs to be placed, which is why they are encouraging doctors to double and triple check the orders they send. I personally love the idea um, of computerized provider order entries and believe that people ought to continue to work and improve the system until we have minimized the errors, therefore removing the thin lines that the doctors walk on. As stated before, doctors currently have to double and triple check the order, which may lead to alert fatigue, therefore taking this whole process back to square one. But if the system continues to be developed and the number of errors ought to decrease, removing the need for doctors to triple check and consequently reducing alert fatigue.